We launched in 2019, and we were quickly embraced by the community and by hospital partners, and expanded rapidly with our forensic nursing program and in contracting with different hospital facilities, just because we made that service so easily accessible for them. Within the first 3 or 4 years of us launching, we had over 70 hospital partners. In 2023, we expanded to North Texas, where we serve over 20 hospitals, and to San Antonio and surrounding counties for an additional 55 hospitals. Our model has enabled us to expand geographically and provide care in communities for easy access within a victim's reach.
San Antonio has around 2 million people and a lot of surrounding rural areas with significant needs, but not a lot of access to services. So there might be one hospital in that county. And so prior to our expansion in that area, every adult patient had to transport themselves from wherever they were down into the medical center in Bexar County.
We have a large staff of full-time forensic nurses. They really are experts in the field because they're servicing these patients day in and day out, taking care of these victims and specializing in that. They come off orientation and they're certified through the state of Texas, and then immediately they start working on their international certification. And so they are invested in continually learning. We're able to serve in so many different locations because we have really perfected our mobile services. We work off of delegated orders from our medical direction, and that allows us to really go into any facility. So we can contract with different hospitals, different clinics, and we are even able to go into different environments like nursing homes and juvenile detention centers.
Our model really takes that pressure off those emergency rooms to be able to provide these services. So we're able to meet that patient where they are, help the hospital, let them have services by utilizing us. And so these victims can now show up wherever they're most comfortable. We can go in and see them, and they don't have to be bounced around or transferred to different locations in order to get the exam that they need.
Our goal is to provide a safe and compassionate care to these victims of violence. They usually need a lot of resources and help to go through this process, and there are things that we can offer them through our services.
A forensic nurse can take care of a patient that has been a victim of multiple types of crimes, so maybe trafficking or child abuse, elder abuse, sexual assault. Obviously, that's what we're most commonly interacting with, but also domestic violence, even suspects. So when we think about the bigger scope of forensic nursing, SANE nursing just falls into one of those spaces.
Forensic nursing has grown a lot over the last 3 to 5 years. A lot of it is because we're seeing the changes over time of what patients are needing and what victims are needing. And then we're also seeing the benefits related to forensic exams and advocacy and forensic interviews. So we're seeing better outcomes in court processes, and then we're seeing better outcomes for our patients in their mental health and the way that they recover, and moving from that station of being a victim into being a survivor.
We do collaborate with a bunch of different people. You know, we have the forensic investigators that do their part. We have law enforcement that does their part. We have the forensic nurses, which is us, that we do our part. We have advocates that reach out. You know, we have all these different aspects that all have to work together, and we all have to communicate to really get a full case and to really get a full story for these patients.
Well, after we get done with our medical forensic exam, we would have an advocate on staff hold out their hand and say, hey, let me help guide you to the next step, whether it's food and shelter or counseling. Otherwise, victims are kind of left there to figure out the system on their own.
At the Forensic Center, our primary goal as advocates is to ensure survivors have access to resources. We achieve this by collaborating with sexual assault programs in each area we serve. This partnership allows sexual assault program advocates to respond alongside our forensic nurses during medical examinations. This collaboration is crucial because it reinforces to clients that they are not alone, and it facilitates a smooth transition between victim services.
It's really hard for victims to come forward, and so when they do come forward, we really want to nurture that, and that we're doing something for them, hopefully trying to take that power back that they may have felt that they lost.
The mission here is to make sure that victims are met where they're at, so that they are not having to go 100 places to try and find the resources that should be readily available, and continue to connect them with other hands down the line instead of falling off somewhere in the middle.
Even 10 years ago, there was 8 facilities in Houston and surrounding areas that you could go to for an exam. 8. and they had gone to the wrong place and the wrong place and the wrong place, and they kept trying again. And I can't imagine what that would feel like, to be turned away and told to go somewhere else and have to show up to the next emergency room and tell your story again, and then told, oh, we don't do that here, you're gonna have to go somewhere else. And I really, truthfully, I just really wanted to make that better.
There's a lot of really sad things that go on in this world, and be able to be that person to help them, begin their healing process is really rewarding.
My hope for people that I see is that they know that they are more than this situation, that they are still a whole and complete person, that they are cared for, and that they have an army of people behind them and beside them that want to see them recover, that want to see them win, and that want to see them get justice, however that looks like to them.